Hello again, boys and girls. This is Patrick with another episode of After Work. It's about 3:30 in the afternoon, and my watch is broken. I went to Target to go get another one, and they weren't selling it there anymore, which makes me very sad because it's a calculator watch, and I really need a calculator watch to do math, or the kinds of math that require adding and subtracting things. You can see right here, that is my calculator watch, and I found like the replacement watch bands at Target, but I wasn't able to make them work, so I just decided, forget it, I'm just going to stick it in my pocket, pull it out when I need it, that's fine. It's too bad the other side of the band didn't fall off, because then I could use it like one of those European style where you pin it to the chest, you know? Maybe I could still do that with it upside down. Maybe that would look better, because I could just lift it up and look at it. It won't be reversed. Maybe I'll do that. So yeah, I'm keeping my visit average way up lately. I'm having a lot of turnover, a lot of people, a lot of new patients being admitted, and a lot of those same new patients dying. I have one patient in an assisted facility, assisted living. No, it's an independent living facility. It's like, you know, retirement congregate living or whatever, and that's kind of interesting. I haven't been in one of those places in a while. When I was filling in and doing per diem, I would go to them more often, but now one of my regular caseload patients is staying in a place like that. And of course, first priority is to get them out of that place and get them somewhere else. Because places like that are very expensive, like $4,000 a month or so. And hiring somebody to stay overnight with you and take care of you in one of those places is also expensive, like, you know, around $130, $200. So unfortunately, a Title 19 application, which you need to receive Medicaid, is, you know, it takes a couple of months to go through. So if you don't plan for these things in advance, it can sometimes be a little bit of a hassle. What else? Got the volunteer appreciation lunch coming up in like a month or so. That should be fun. A couple of new classes started. The core curriculum 104 and the nursing 530, and both look like pretty fluffy classes, but just a little bit more work and a little bit more hassle, but still very light on content. The first assignment that I did yesterday to get it done, you know, out of the way, was for the core curriculum 104 class, the Human Search for Truth, Justice, and the Common Good. Had a very deceptively simple first assignment. It was simply to describe somebody in your life you would call a good Samaritan, and what about that? What does that mean for your life, or, you know, whatever. And you know, I thought it was just going to be another fluff assignment, but I sat down and I thought about it really long and hard, and I came to the conclusion that I had never witnessed an act of charity comparable to, you know, the passage in Luke where there's some guy, like, you know, lying in a gutter and the priest walks past him, but a Samaritan, you know, bathes his wounds and does all those other things. The Samaritans, in case you didn't know, were like a subsect of Judaism. I forget the particulars. I looked it up on Wikipedia the other night. So I thought like long and hard about this for a couple of hours. I couldn't think of a particular time. I mean, yes, I had witnessed at various points in my life or experienced personally, you know, occasions of kindness, you know, where somebody did something nice for another person. But in pretty much all of these cases, the reason for that action was either some kind of kin selection pressure, like this was somebody who's part of my group, so I'm going to help them because they're like me, and that doesn't really fit the criteria of the passage in Luke, or it's because the people are both involved in some kind of joint venture. They have some kind of shared purpose, like we're both attending this music festival, so we have something in common, you know, or we're both working on this project together and our success or failure is linked, of each of us is linked, you know, that kind of thing. Or that act of charity or kindness was actually defined by that person's occupation or social role at the time, like it was their job to do it, which also doesn't fit the criteria. So I could have just made up anything, really, and probably gotten a perfect score on it. But I was not able to actually think of anything I'd ever seen anyone do to come to the aid of someone who was both different from them and in dire need of help. In a circumstance where it was not your job to do that, So it took me a lot longer than I expected it to. I was working on it from like 9:30 until 11:30 at night last night. I figured it would just be like a little 20-minute assignment, and it should have been, really. But it wasn't. And then, my nursing theory and professional roles assignment for tonight is something equally BS-y, and I think it's also related to charity and those kinds of things. But it actually involves a little more like citation of text resources, because they expect that in the nursing classes. You can't just talk off the cuff like I can in the 100s level classes, a little higher academic standards in the 500s level classes. Not by much, mind you, but just enough to make extra work for me. So I really can't work on homework before dinner. It just doesn't seem right. So before dinner, I'm going to look up exactly what reading I have to do before I write the assignment. And then after dinner, I'll work on the assignment. And I think that's what I'm going to do. After this 8-week cycle, I'll be pretty much halfway there to being done with the program. So that's kind of nice. I think I'm supposed to finish in like 2013, like mid 2013 or maybe early 2014 to get my master's. I think bachelor's in early 2013 and master's that same year or the first semester of the next year. So that'll be good. Nice to be done with this. We had our interdisciplinary team meeting today, so I got to catch up with people about what kinds of things are going on, and I got some good advice from the pharmacist and the doctor. We had a stand-in doctor today. Our usual medical director is away for the week, so we had another physician in her practice covering for her, and got some good guidance on a couple of difficult symptom management issues. One involves antidepressants for somebody who's seizure prone, and then the other one involved bowel regimen, just a really tricky bowel regimen, like intense constipation and then laxatives and then diarrhea and then holding off on the laxatives and then family caregiver not reporting to me what's going on, so I'm finding out about it when it's past the time to do something about it. So I got some good guidance on how to alter the regimen, but it all depends on that family caregiver. If they're not following directions or keeping you in the loop, then I guess one of the more difficult things to do that one of my coworkers had kind of been advising me on is being able to let go of the outcome if you do the best that you can, and the problem is the right thing isn't happening, not because of you, but because somebody else isn't doing the right thing, then you can't take it too personally. Which is hard to do because, when you're case managing, it feels like it's all your responsibility, But sometimes you just can't get through to people, and that's okay too. As long as I'm documenting defensively. Oh, this is interesting. There's a school bus with a stop sign pulled out, and there's a police car going lights and sirens. Is the police car going to stop? Nope. Police car's not going to stop. That's funny. Alright, well, that's it for today.